But I have learned a lot about how we can pull together during these tough times that also take a very long time to sort out. So this doesn't feel like it's going away anytime soon. And I think that's something that we're really working to try to support our staff on.
Thank you so much. And thank you for all the research work you're doing. And our leadership has been repeating that science, solutions, and solidarity are the way forward. Moving from the US, Mike, Maria, welcome and good afternoon. Could you maybe update our viewers on what's the global situation and where are the hotspots at the moment?
Hey, Alex, I'll start and maybe Maria will come in. Hey, and just to reflect, I think Carlos and Colleen outlined it. There are brave and dedicated and courageous health workers, scientists, public health workers, frontline workers everywhere on this planet today. And there are hundreds of thousands of them in the US as well. We're entering into at the end of 1 year, going into a second year of this. It could even be tougher given the transmission dynamics and some of the issues that we're seeing. So we need to really focus on taking the positives, looking at what's worked in every country, and then transferring that knowledge to others. And it doesn't matter, things have worked in communication, things have not worked. Things have worked in governance, they've not worked. Things have worked in science, they've not worked. We've got to find the best possible combination of all that learning across all of our member states, including the United States, where there are so many excellent frontline workers, so many excellent scientists that can help us find global solutions. With regard to the global situation, over the holiday periods and all, we had a drop in reporting, not necessarily a drop in disease, but certainly in the last 2 weeks it has picked up again. And in the last week we've added 5 million cases in a week globally and 85,000 deaths. And when you look at all those, essentially all regions apart from the Southeast Asia region are showing increases. The region of the Americas is still accounting for over half of all diseases globally and 45% of new deaths. The European region is still increasing, but has had a lower increase over the last week or so of 10%. But it still accounts for over a third of new cases globally. And equally, we've seen smaller increases in our Eastern Mediterranean, North Africa, Middle East region. So the African region again has had an increase of cases, although it's starting with very low numbers. So we have a very mixed pattern around the world, and even within individual regions, a mixed pattern. Certainly in the Northern Hemisphere, particularly in Europe and in North America, we've seen that sort of perfect storm of the season, the coldness, people going inside, increased social mixing, and a combination of factors that have driven increased transmission in many, many countries. And then in some countries in Europe, including the United Kingdom and Ireland and others, we're seeing the emergence of variant strains that are certainly adding to transmission and helping to drive transmission. So as we enter the new year, we still have exactly the same factors driving transmission as last year, but we're also looking at other drivers. Having said that, the Northern Hemisphere in Brazil and other countries, we've seen large increases in cases. Similarly, in South Africa, which has better surveillance than other countries in Southern Africa, seeing problems there. So this isn't just a Northern Hemisphere phenomenon. We're seeing a variation all around the world, but certainly a combination of factors in the Northern Hemisphere that require immediate attention. Maria.
Thanks, Mike, and hi, Alex, and we're so pleased to have our guest from Emory today. So it's wonderful to have you on. I mean, as Mike said, it's a mixed picture. I think one of the things that is important to note is that we are not in the same situation as we were a year ago. We know so much more now than we did a year ago. And two of the points that were raised by Carlos and Colleen are, there's always room for improvement. And that's true in every country, even countries that have done it exceedingly well at controlling transmission. And there's much to be proud of. So I think, you know, everyone who is working towards this collective goal towards ending this pandemic has a role to play, and we need to encourage that and support that and provide the enabling environment for people to take the right actions to keep themselves safe and their loved ones safe. You know, we are seeing some countries that have brought transmission under control. They've opened up their societies and they're working incredibly hard to keep transmission down. We cannot emphasize enough the importance of maintaining that. So if transmission has been brought low, do everything you can to keep it low. You know, prevent any of those embers from turning into forest fires. And countries are showing us how to do that. It's much easier to control transmission when you have small numbers of cases than when cases are increasing at an exponential rate. But the good news is that we have a lot of tools right now that can help bring transmission under control. We need resolve, we need determination, we need focus to be able to adhere to those interventions that are put in place. The factors that drive transmission in the beginning are still driving transmission. We do have the introduction of some virus variants that are being detected in a number of countries, but this is to be expected. Given the global spread of this virus, given the intensity of transmission in some countries, there are pressures that the virus is under to want to be more fit, to want to infect more people. The goal of a virus is to replicate, it's to produce more virus. And it needs a human host, it needs a body or an animal to be able to do that. We have some control to prevent that from happening. But it does make the situation that much harder, Alex. But it doesn't mean that we've lost the battle here. There's a lot that we can do. So mixed picture, with the holidays over the last several weeks, in some countries, the situation will get a lot worse before it gets better. And I think those countries know who they are. And I think those countries are putting systems in place to be able to make sure that they can treat patients, because more cases means more individuals who will need hospitalization, who will need clinical care, who will need ICU beds. And unfortunately, despite great efforts and our ability to provide oxygen and dexamethasone and others, people will die. So we have to do what we can to prevent as many infections as we can. But good news is we know a lot more. We have the resolve, we have the determination. Everyone is exhausted, but we all want to end it.
Thank you, Maria. Dr. Colleen, you would like to add something, please?
Yeah, Maria, I really like how you put that sort of description that you said, because I think one of the things that I've been struck with, even during your comments here, is the psychology really of this pandemic, right? And so we're talking about resolve, we're talking about resilience. These aren't always things we talk about when we talk about a pandemic. I think there's a psychology of misinformation. I've been trying to do as many community things as I possibly can, engaging neighbors and colleagues and friends. That's why I really enjoy speaking, because I think it's important to talk to people about what they're thinking, to hear what they're thinking, what is preventing them from making good choices, what is preventing them from continuing to mask and hand hygiene and social distance. So I think there's an aspect I think we really should learn from. I think public health communication, obviously we already believe should improve, but I think there's an aspect to that about how people respond to that information. And, like you said, Maria, people are getting, I'm in the hospital. I see our deaths, our people that are on ECMO, our people that are on ventilators. That's a very specific response that I have to this. But I'm then in the community where people don't understand that their behaviors affect the people that are in our hospital, that their behaviors affect that nurse that's just really exhausted and taking extra shifts, or when on the shift is overwhelmed by the number of patients or the acuity of patients. So I think there's just so much for us to learn that I think we then teach ourselves and teach others in the decades to come about resilience, about that we are a community, and even sort of grace and kindness among each other. I think giving people the benefit of the doubt, trying to encourage people, understanding that people are responding in stress behavior. These are some of the languages that we've started, or phrases we've started to speak. And that's just not something I would have anticipated in all the years of preparation and emergency preparedness that I've learned over the years.
Thank you so much. I would invite both you and Maria to say once again, what is that toolbox that we all have that we can apply immediately and to prevent virus from spreading? Maria, do you want to start?
Sure, I can start. I mean, there are different types of toolboxes. You know, there's a toolbox that governments have where they're working across all of the different sectors. I mean, from the beginning, we knew this was not just a health response. There is no health or economy, it's both. And all of the sectors of the government need to come together and provide a comprehensive approach to this. There are tools that individuals have. And you hear me talk about this a lot, Alex. You know, it's about the individual levels that I can, that minimizes or reduces my risk of exposure, it reduces my risk of infection. And if I happen to be infected, reduces the possibility of me passing it on to someone whom I love and cherish most in this world. So this is about hand hygiene and good hand hygiene with soap and water, with alcohol-based rub, physical distancing. I mean, one of the most important things that we can all do right now is physical distancing. The further, the better that you can handle, but make sure that you keep that distance from people who are outside of your immediate household. Wearing of masks, but making sure that when you wear your masks, you have clean hands. You have clean hands before you put your mask on, if you touch the outside of your mask, and when you take your mask off. The proper disposal of masks. I think we should start adding that to our communications because we're starting to see environmental waste. I can't tell you how many masks I see out on the road and on the side of roads these days. So we have to have the proper disposal of masks as well. It's about respiratory etiquette, sneezing into your elbow. It's about information, using information as a tool to help you minimize and reduce your risk throughout your day. It's about staying home if you're unwell, staying in isolation if you're a case, staying in quarantine if you are a contact, but all of that needs to be supported. And that's where government comes in and our communities come in providing support and care so that it's easy for me to say, go into isolation if you're a case and stay in quarantine if you're a contact, but people need to be supported to do so that they can feed their families and so that they can make sure that they earn a living and take care of their loved ones. All of this is our tools and they need to be applied, but these tools can't just be applied one or another. You hear us say a lot, do it all. We can't have an over-reliance on any one of these measures. All of them need to be done together and in combination and depending on the intensity of transmission. As part of this comprehensive approach, we need a good system in place for surveillance, for testing, for strategic use of testing, for rapid results, for testing linked to public health acting sake isn't really much good. But if it's linked to public health actions that can protect an individual and prevent onward spread, that's a strategic use of testing, no matter what type of test you use, PCR tests or antigen-based tests. There's a lot of good tools that are out there now. So it's quite a big toolbox that we have. And the last one coming online are vaccines and vaccination, an incredibly powerful tool that will help us end this pandemic. But it's going to take some time to roll out. So in the meantime, as vaccines are coming online, and Alex, you know, and Mike, you hear Mike and I and the Director General and Bruce and many people say, our goal is to make sure that vaccines and vaccinations are started in all countries for those most at risk, not just for all people in a couple of countries. So it's really important that we work towards that. But in the meantime, we have to hang in there. We have to put in the work. It's not going to happen to us. We have to contribute to preventing the spread and using those tools in the toolbox.
You know, Maria, I think you said it right, but I also remind people that we have to put a focus on equity, right? Because, you know, I can isolate because I have a home, but there's thousands of people, millions of people globally that don't have homes, that millions of people that need to go to work where they cannot socially distance, and millions of people who have no way to access medical care. And I really, really think that there is a major role for countries and for society to provide the necessary support to individuals who is not their behavior, but is who they are, where they live, the circumstances that they have that puts them at risk of infection. And if we don't address that, we will continue to have disparity. So I think it's a really important thing that we look at what things can be done to mitigate risk about those individuals who simply are unable to do what's necessary to prevent their infection.
Yeah, and I think just one more thing to add that at the end of Maria's amazing toolbox, and then also what Carlos just said, is there has to be some level of creativity and innovation in this. So if you don't like wearing masks, figure it out. So there is a mask that will work for you. There is a mask that you can wear in whatever you need to be doing. And so that's what we've been really encouraging and trying to do on a local level is it's not just one size fits all. So let's figure out how you can we get past this sort of not wanting to do these things, for instance. That's a subset of our population, at least here in the United States. They don't want to do these practices. Well, if you can just, it's okay for you to not stand right next to somebody in a store. It's okay for you to wear a mask and you need to hand hygiene. Just getting through the psychology again, or the reticence to do those things, I think is just part of getting to acceptability. Healthcare workers since March have not had an issue with wearing masks and eye protection, doing good hand hygiene and social distancing all of this time. So I think the population needs to learn innovation when it can be, or like Carlos said, if there's a scenario where people can't have the resources to innovate or protect themselves, then we owe it to them to help find solutions in those areas.
Thank you so much. Dr. Mike, you would like to add something, please?
Yeah, no, just reflecting on some of the things that have been said, but certainly when Colleen talked, when we talk about countermeasures and for epidemics, we're often talking about vaccines and diagnostics and therapeutics and intensive care units and all of this stuff. But it's interesting when we talk about tolerance and kindness and solidarity, that they're probably the most powerful countermeasures we have right now. Is a common understanding amongst ourselves of what we are committing to do as citizens, as members of our own societies. Knowledge right now is the most powerful countermeasure for the spread of this disease. Informing yourself of all of these risks and taking action. We said it in a previous Facebook Live. You have to have the attitude that this disease ends with me. I don't know if I'm infected or not today. Therefore, I have got to do everything in my professional life as I move around WHO, as I move around in town. I have got to assume that I may be carrying this virus, and therefore I have got to act in a way that protects others. That is my responsibility. I am responsible for that action, and therefore I have to take the most precautions that I can. I got to pay it forward. I don't know that if I infect somebody else, they may or may not die. The person they infect may or may not die. The person they infect may or may not die. I do not know the consequences of my actions 2 or 3 or 4 generations down the line. I'm not going to take that risk. I'm going to do everything humanly possible to protect myself, but I'm more importantly going to do everything humanly possible to make sure that I do not infect anybody else, because I do not know the consequences of that infection 1, 2, or 3 generations down the line. And we need to focus on that. That is about individual and collective responsibility, and that has to drive us forward now. But governments also need to be coherent. They need to be coordinated, both between governments and within governments in terms of national to federal to local level. They need to have a plan. That plan needs to be communicated. That plan needs to be funded. That plan needs to be executed. There is no point asking ordinary people to do extraordinary things unless governments are prepared to go right to that level of extraordinary investment and support. You do not ask sports people to do extraordinary things without giving them the tools to achieve. You don't ask people fighting in our armies to do extraordinary things unless you give them the means and the resources to achieve that. We cannot ask our communities to do extraordinary things unless we make extraordinary efforts and extraordinary resources available to support them in doing that. We have got a gap in time now. Vaccines are coming online. And yes, I do believe vaccines will make a huge difference, but they're not here yet in enough quantities and in enough people to make that difference. We've got weeks, if not months ahead of us, in which our weapon is our knowledge. Our weapon is what we know about this virus and what we know about its transmission, and stopping that transmission and saying to ourselves, this disease ends with me, and governments supporting each member of our society to achieve that goal. This is a complicated game, but it is, as I've said before, we often in epidemiology talk about populations, and we say N equals 325 million, the population of the US, or N equals 7.4 billion, which is the population of the world. Well, there are 2 N's that are important to me, and that is the N of 1 of each person that dies from this in this epidemic, and the N of 1, which is me as an N. I can do something today. And if I do something and the person beside me does something and the person beside them does something to stop this disease, then we stop this disease together. And I think we have to recommit ourselves to that goal. And then we have to support communities in doing that. And we have to deal with the inequities that come with investing in our communities and make sure that we empower everybody in our community and give access to everybody in our community. And I think we're in January, it's a year into this, everyone is tired, everyone is exhausted. There's a lot of change out there. There's a lot of uncertainty, but I do believe we have the power to do this. And as vaccines roll in, we can hopefully end this horrific pandemic.
Thank you so much, Dr. Mike. And there are a lot of questions coming already from our viewers, and this one comes directly to you. Our viewer from Twitter called Santos says, question for Dr. Mike Ryan. How would you advise governments to communicate to its people in light of the current warring situations? What are your thoughts on the quality of the risk communication so far?
I could ask you that question, Alex. I think it's a difficult one because I think different governments have done different things, and each community expects a different form of communication. And I think there's a different social contract in many situations. In some societies and cultures, people expect governments to take decisive action. They don't expect to be kept informed every minute of the day. What they want is very clear indication of what's being done, and then they trust the government to get on and do it. In other societies, particularly in ones where we have, large levels of personal freedom and big penetration of social media, it's a much more dynamic challenge. People want information in real time. You're held accountable in real time. So it's not the same. It's not a one size fits all around the world. I think risk communication and engagement, where it has worked, has been powerful. Where it has not worked, it has been a huge element in driving the spread of this disease. So I would say it's a very important issue. It's something we haven't invested enough in pandemic preparedness. I think communities and community knowledge and community participation, communities' ownership of the response, and the way in which governments communicate with communities to build trust is one of the weakest elements of pandemic preparedness, and it is demonstrating itself day after day in this response. However, there are really good examples of where it's worked and how it can be done. It doesn't cost the earth. It requires transparency. It requires a commitment that informing and dialoguing with communities is actually central to success. If you're only communicating because you have to, because you're spinning the word, you're spinning the message for this week, and it's all about reputation management, and it's about staying out of political trouble. If you're communicating on that basis, you will wash up on the rocks. I fundamentally believe to communicate truth, you've got to be honest, you've got to be regular in your communications, you've got to express and you've got to be empathic with people, you've got to have the information people need, and you've got to be correct as much of the time as you can, but at the same time, you cannot sit on the fence all the time. So there are lots of things and lessons we're learning in this, and I think it is something we just haven't invested in, and we have a duty in this response to learn the lessons of communications in this response, do it better now and into the future. I know, Alex, you've been doing a lot of work, and the team here in comms on managing how we better engage on social media, how we work online and offline in communications with individuals and with communities, and how we improve our performance in getting good information out there and generating the right conversations. It's one thing to complain about all the bad information and complain about people dominating the message in a negative way. Well, that happens because we leave vacuums. And I think we have to occupy the space with tolerance and with kindness and with solidarity and with knowledge and with communication and with openness. And we've got to flood the zone. I don't know, in the US, I've often heard that term in American football of flooding the zone. We've got to flood the zone of engagement with good communication, with positive communication. And positive communication doesn't mean saying everything is all right. Positive communication does not mean no criticism, but constructive, positive engagement with facts and reality, and constructive criticism and a willingness to be flexible and adapt. If that's on the table, I believe we can communicate much more effectively with our communities. But it's a real science. It's not a soft science, as people call it. It's a real science of understanding how communities engage, how they understand, and how they want to be communicated with. And we can do a whole lot better at this.
You know,
Thank you, Mike.
I think,
Please go ahead, Dr. Carlos.
I mean, I agree with Mike, and I think the other thing is I tell people that communication nowadays is about truthfulness, it's about transparency, it's about timeliness, right? You got to do it on time, you got to say the truth, and you have to, and if you do those things, then you generate trust. What's really hard in a pandemic, and I think the toughest thing to do as a communicator, is that we don't have all the answers. And how to communicate uncertainty is very difficult, because then when you know, at the beginning of the pandemic, we weren't sure masks work. Now we are sure they work. And it's always right now, for example, with vaccines, we don't know if vaccines prevent infection. We may in the future, but it's really that complicated thing of trying to communicate the facts that you have without making people feel that they cannot trust you. And that's really a very complicated skill. And I wish, you know, one thing that I would want to see is our politician and our people that are really the communicators, our leaders in countries, to really learn how to do that, because those that do it well are so much better at getting the message out and to really getting people to understand what they're talking about. And then the one thing I would ask leaders around the world is do not disseminate misinformation. I think the biggest enemy that we have besides this virus is misinformation. And if we don't combat misinformation, then we're not winning the war against this virus.
Thank you. Maria, Colleen, would you like to answer this question as well?
Yeah, I think so. I mean, I think we need to be very clear that misinformation kills. You know, if misinformation is circulating around, it can put people in harm's way, and it kills, and it can kill, and it has killed. And I think we need to do everything that we can to make sure that we articulate what we know, what we don't know, and what we're doing to find out. I agree. You know, good communication is open. Mike, you're on. Mike, you're not on mute. There you go. To communicate openly, honestly, transparently, regularly, with empathy, and say when we don't have an answer to something. But don't just end there and say, well, here's what we're doing. Here's how we are working towards getting an answer to that. It's very hard to communicate evolving science. We get a lot of questions of everything wants to be yes or no, or black or white, or, you know, one extreme or another extreme. And in this pandemic, we are learning over time. Our knowledge is evolving over time. We are adapting messages, and we are adapting guidance to make sure that people stay safe. And when you do adapt, some people hear that you've changed and therefore it was wrong before, but we're growing, we are constantly growing. But there's a very different thing to be talking to someone as opposed to talking with someone and listening to people. And I don't think we do enough of listening to people to really understand the barriers to adhering to measures that are put in place, barriers to anything. And there are different reasons for that. And we are working very hard, as I know you are as well, to engage with as many different groups as we can, with different leaders, with youth groups, with religious groups, with scientists, with different disciplines across the sciences and academics and public health in all countries, so that we can hear and we can take that into account in our knowledge base. But it isn't static. You know, knowledge isn't static. Communication isn't static. But having said that, the consistency in the message. One of the challenges we've seen is differences in messages to the same question across different countries. The science is the science. You know, how people interpret the science, we do collectively with thousands of scientists around the world. The politicization of some of these aspects has been incredibly challenging to work through. I don't think any of us anticipated how challenging that would actually be in the current climate that we're in. We all know, we've all worked in outbreaks before, and we know that the scientific part of an outbreak is quite small and the politics of an outbreak is quite big, but this is a whole new level. And I think we can all do better. I agree with what's been said, we can all do better, but clear, consistent, regular, humble communication with empathy and a human touch is really quite important. And we will continue to do so. I feel very privileged to be part of the team that gets to communicate. It was never part of my plan in terms of my scientific background, but it's a difficult thing, Alex, as you know, and there's different platforms which we need to reach out to different people. So we'll keep at it, making sure that we do this regularly.
Thank you, Maria. And speaking of communications, here is the follow-up question. You were giving advice what governments should do, but our viewer Lottie Nagu is asking, watching us on Facebook, is asking, what would be your advice to public health volunteer workers in other reserve communities where awareness and non-positive communication is almost non-existent? Colleen, would you maybe want to start? You were mentioning also community work. So what would be your advice?
Yeah, so do you mind repeating the question just so I understand the
Of course.
text?
What would be your advice to public health volunteer workers in under-reserved communities where awareness and positive communication is almost non-existent?
Yeah, so I think that it's really been said in lots of iterations by both Mike, Maria, and Carlos, just about, I would start by listening. I think one of the things that we've been doing locally is trying to understand people's reasons for not getting vaccines, for instance, just as an example. And so once you start listening, this person's reason could be very different than this person's. And that's how you, I think, architect your communication. So I think, like Maria said earlier, if you go in to just, we should flood the zone, as Mike's reference to football, American football, which I'm sure is going to be lost on some, kind of lost on me. But we should fill the vacuum with positive and constructive communication. But also we need to remember who we're serving in that moment. And so, for instance, we have a certain group of our population that don't want to get the vaccine because they are concerned about the side effects keeping them out of work. And that is a concern for their job and their economics, personal economics. And so you're gonna have to figure out what the vacuum is and then how you can fill it. And I think that's the most critical when you start by sort of doing like a shotgun approach, like I'm going to tell you everything I know. I think some of that gets lost. Try to figure out what does that community, what does that underserved community need the most at this time with communication, and start there.
And Alex, if I could just add to that, I think it goes beyond COVID. These questions, and Carlos was talking about this before. Sorry, Carlos, I think you want to come in as well. But this still goes beyond COVID. It talks about the inequalities that we have, the injustices that we have with so many communities around the world, and understanding, what is happening, beyond a pandemic that has exacerbated many problems that have been here for decades. But trust cannot be overstated here. Building trust takes time, and there's reasons why communities don't trust. But finding the ways to listen and to understand, but also addressing the needs beyond the immediate pandemic issue itself, which is hard enough, but really going beyond, looking at communities that are underserved, that don't have access, is really something that needs to be addressed. And the pandemic has just exacerbated that even further.
I think the other thing I tell public health workers is go and get your information from trusted sources. I think there's so much misinformation out there that if you're going to be educating a community, get your information from a trusted source like WHO. And if you're getting it from some other source that you don't know, check it out before you disseminate it. Because, if you are a trusted voice and you disseminate unwillingly, you disseminate misinformation, then you're just spreading lies. And I think that's something that is really important for public health workers, is to really find your messages in places that you have reliable source of messages. Thank
you. Thank you, Dr. Carlos. I think the next question you also could take, because it's about vaccines, and you mentioned your direct work on a research on COVID vaccines. April Samuels, watching us from Facebook, is asking, how many different vaccines are available in the world right now? In the US, I just know of 2, wondering if there are more.
Oh, there are many more, and there are many coming along. And I think one thing that, again, going to a sports analogy, Dr. Anthony Fauci says that we're going to need many shots on goal, and we're going to need many of those shots to be goals, right? So there are many vaccines, and because we need to vaccinate the world, we need many effective vaccines. And so far, we have the Pfizer, the Moderna, the AstraZeneca, the CanSino from China, the Sputnik from Russia, the J&J, I mean, ideally, we'll have 7, 6, 7, 8 vaccines in a few months that we can actually be using, because we're going to need a lot of vaccines, and they're all very different. But at the same time, if they offer similar levels of protection, if they offer similar levels of problems, then they're going to be fine. And my advice to people is, right now, with the available vaccines and the available science, if a vaccine is approved in your country and you offer the opportunity of vaccination, it matters less which vaccine you get. It matters more than you get the vaccine.
Thank you. Here's another question about vaccines from Mohammed Abdel Rouf. On which basis were COVID-19 vaccines of Pfizer, BioNTech, and Oxford AstraZeneca found effective?
Right, so we actually participated in Grady Health System, where Carlos also spends his time as was one of the leading sites. And so the way that these studies work are that you vaccinate everybody either with placebo or that vaccine, and then you follow them to determine whether or not they get infected with COVID. And so that's really the standard by which vaccines are utilized. Getting to the number, which I think was between 40,000 and 70,000 vaccinees, probably could only be something that could be done during a pandemic. Having been involved in many other vaccine studies, it takes a lot longer to get those types of numbers to be able to determine if something is effective. And remember, or efficacious. So remember, we're talking about things in a trial setting versus real world, and we're sort of undergoing that real world effectiveness is really the word that we use when we look at how things are going to happen practically as we apply them to all comers. So very robust data and very robust immune response from at least the Pfizer and the Moderna, which I know the most about and are available in the US.
Thank you. The US is one of the countries who has started mass vaccination. So can you maybe reflect on what are the challenges that you've been facing? And also, some people are concerned about the safety. So what are the actions you are taking to increase the vaccine acceptance?
So let me start by saying that safety is a prime concern of all of us, right? And when you work on vaccine studies, you want to be sure that the vaccines are effective, but you also want to be sure that they're safe. And I think in the thousands of people enrolled in the studies, vaccines have shown to be incredibly safe. And that's why I personally have received my vaccine. I would not take something that I didn't think would be helpful and would be protective. And I have recommended it to my patients, I've recommended to my colleagues. So I'm worried less about the safety of the vaccine. I worry more about people not getting vaccinated. What we had in the United States, and I think the experience globally, is that vaccination is hard, and especially the kind of vaccination we want to do, it's really hard, because you got to get the vaccine to the right places, and you have to get it into the right people, and you have to do it quickly. And this process is going to require a lot of innovation, a lot of creativity. For example, our Emory University has set up a vaccination site, not in the hospital, but in a shopping mall. They took over a store and they have vaccinated people there. And on the first weekend that we vaccinated people, we were able to vaccinate close to 7,000 individuals. So I think we need creativity. Now we have a vaccination that is a drive-through vaccination. So if you're in your car, you just roll down your window and you get your vaccine, and then you park somewhere, you watch until then you're let go. I know that, for example, they're using Disneyland is about to start vaccinations. I know that a baseball stadium is about to be a site of vaccinations in New York. I think around the world, we're going to need innovations like that. We're going to have to take vaccines outside of the healthcare system. And I think we're going to have to take a lesson also from the ARV, antiretroviral rollout in Europe, in Africa. We were able to get millions of people in antiretroviral therapy because we did task shifting. And I think task shifting is going to be critical into getting vaccines into millions of individuals. So I think innovation, creativity, and really community engagement is going to be so critical in order to get people vaccinated globally.
Thank you very much. Maria, Mike, would you like to add something?
I just want to maybe all the points, I agree with all the points, but let's put some realities on the table. It's been about 36 days since the first countries started vaccinating in the world. We've probably, I think we have about 28 million vaccine doses have been administered so far. 5 different vaccines or platforms have been used for that administration. 46 countries approximately are now vaccinating, but only one of those countries is a low-income country. Fully 38 of those countries are the high-income countries. When we look at this, we really have to look at this in terms of equity. It's fine that some countries start first, someone's got to start first. But we also have to look at this not just as a vaccine safety issue, not just as a vaccine effectiveness issue, and not just as an issue of how do we get our populations to want vaccine. There are populations out there who want and who need vaccines who are not going to get them unless and until we begin to share better, unless and until there's more support for the COVAX facility, unless and until the wealthy countries share and donate more vaccine into the system. So at least we can begin vaccinating healthcare workers and the most vulnerable in low-income countries. They don't have access to this. It's not about being low income. They just do not have access to those vaccines yet. We also need the companies out there who haven't submitted files and dossiers for emergency use authorization to WHO to do so, because it's really important that we have the information to give the necessary approvals so the contracts for those vaccines can be triggered. So everybody's got to do more. The countries have got to do more in the north to both support the COVAX initiative and to try to do more to share and donate vaccines, to at least begin vaccinating those frontline health workers and most vulnerable people. Companies need to do more. Everyone's worked hard. Everyone's tried to make this work. The COVAX initiative is the best opportunity we have to deliver vaccines equitably around the world. COVAX is working. What we need to do is put more effort into supporting COVAX to achieve that, because notwithstanding all of the other issues, if we don't get vaccines to people, they cannot take them.
Mike, I totally agree with you. And let me just say that as an American, I would want to personally apologize for our government pulling out of COVAX. And hopefully in a few days that will change, because in fact, COVAX is the best initiative, is the best thing. And if we don't have everybody vaccinated around the world, if we don't share, if we don't do more of a global approach, we're never going to get out of this mess. So I could not agree with you more.
Thank you very much. Mike, maybe this is the next question that you could take, because our viewer is asking what WHO is doing to support people in areas where there is war or displacement and they're staying in crowded places.
That's a good one. And I think we could probably have a whole Facebook Live or a whole discussion on that, because a lot's been done. But I would, and some of that's, a lot of that's done with support of WHO. But I have to take my hat off here to the humanitarian coordinator in New York, Mark Lowcock, his team, to Filippo Grandi and the other people at HCR, to the teams at the International Organization for Migration, to our colleagues in the Red Cross movement, to the NGOs out there, the MSFs and the IRCs and the IMCs, to the local NGOs who work with people, to the advocates for people who live in fragile, conflict-affected and vulnerable countries, for those displaced and refugee populations, and for those migrants and others who live in difficult situations around the world. We've been doing quite a bit in terms of investing collectively in preparing for the arrival of disease in camps or other settings. We've been doing a lot to build isolation facilities, to do training of local workers, to do education and risk reduction measures in terms of, and it's very difficult, you can imagine, to do physical distancing in a refugee camp. We've been working in camps in all throughout Africa and the Middle East with the Rohingya population in Bangladesh. And again, our thanks to the government of Bangladesh for the work they've done to support us in that, and not only protecting local communities, but protecting those communities in camps. And just reminding governments, all governments in the world, that they are responsible for the health and welfare of all citizens and all people inside their borders when it comes to health and humanitarian affairs. And we do thank those governments who've planned and included refugees and displaced people within their plans, who plan to vaccinate them and have included them in their vaccination plans. And may I remind countries that it is their responsibility to do that. We've also worked with thanks to Seth Berkley and others in Gavi, and with many of the partners like MSF, worked on on a humanitarian buffer that will allow vaccine to be put in reserve for people in extreme humanitarian situations. That's a fantastic facility to have, and we're developing the operational mechanisms to make that work. But again, a lot of work going on right the way through the humanitarian system. We've had a very specific global humanitarian response plan for COVID-19 led by Mark and his team in Atcha, and a huge amount of collaboration in this space. But you know, the life of people in fragile and conflict affected countries, and the life of a refugee, and the life of a migrant is not an easy life, with or without COVID. COVID is just an extra strain in people's lives. It's an extra demand, it's an extra worry in lives that are already deeply affected by hunger, by uncertainty, by insecurity, by abuse, and by the constant risk of physical harm. So we have a double duty to people in these situations, the most vulnerable people in the world, to offer them the best possible support in relation to COVID, but all of the other things that they need to survive. So thank you for the question. It's an important question. We are judged, I think, by the universe, by how we treat and how we support and how we serve the most vulnerable, how we serve the destitute, how we serve the displaced. That is how we will be judged as individuals, and I think as societies. If we keep that at the center of what we do, we will always try to do the right thing in terms of serving them. And I think we have an extra duty of care to those populations where we can help in the case of COVID-19.
Thank you very much, Mike. I know we are running out of time, but there are a lot of good questions, so I'll take a few more minutes of your time to answer at least a few more. This one is coming from our LinkedIn viewer. Why the situation is bad in European countries despite having strong health systems in comparison to many Asian and African countries that are having more fragile health systems?
You want to start, Mike?
Maria, you know, you have a crack at that one, Maria, and I would only presage it with, you really want to know the answer.
Yeah, so it sort of was where I was gonna start with that, but no, I think there's a lot of reasons. I mean, I think when we look at the response to this pandemic, and we look at even the response now, countries that have had a trauma from other infectious diseases like SARS, like MERS, like Ebola, yellow fever, meningitis, have learned from those terrible experiences and have invested in community health workers, have invested in public health, have invested in prevention, have invested in using the tools and capacities that they have strategically. Many countries that have not had that collective trauma, and I keep calling it a trauma because quite frankly, I think it is, rely heavily on systems for treatment in that sense. I'm oversimplifying here greatly. And so there was in the beginning, there was a lot of discussion around, well, that won't happen to us. You know, that is happening in another part of the world. That won't happen to us. We can handle it. We can handle it with our health system. We can treat the patients. Whereas what we really needed was aggressive early action on those initial cases coming into any country, so that any seedings, if you will, we call these seedings, you know, a case coming into another country doesn't have an opportunity to spread it and an opportunity to take off. But countries that have invested in their public health, that have invested in the workforce, have invested in surveillance, have fared better. In Europe, particularly in recent weeks, we are seeing an increase, and some countries are starting to turn the corner because they put in more restrictive measures. But we saw an increase, and in many countries, an explosive increase in cases because of changes in social mixing around the holidays and leading up to the holidays. There are many interventions that were put in place, you know, these tier 2, tier 3 type lockdowns. But we saw many people out. We saw many people shopping. We saw many people having families mixed together. In the US, we had Thanksgiving, we had Christmas, we have New Year's. All of that mixing, all of the opportunities, and if the virus is already circulating, the virus will take advantage of that and spread. So we right now are reaping the consequences of what took place in the previous weeks. So a lot of it is down to social mixing. A lot of it is down to not adhering to the measures that are in place, and there's reasons for that. And we need to do a lot more work understanding the reasons for non-compliance, the reasons for not adhering to messages. But I'm hopeful that countries will be able to turn that corner and bring transmission under control, including the US. I have no doubt in my mind. I'm an American myself, born in upstate New York, a proud American. I've been overseas for many years now, but the resilience and the smarts and the ingenuity and the creativity, the US will turn it around as well, as will European countries. But no one is safe until everyone is safe. And as this virus is circulating, while this virus circulates, we all remain at risk. So we really need to put in the work to be able to make sure that these measures are in place. The worry that I have is this fluctuation between lockdown, non-lockdown, quote unquote lockdown, this fluctuation of yo-yoing back and forth. We need to find the balance of the right measures that are in place that drive transmission down, keep transmission down, but have our schools open and have societies opening up so that people can start to have some semblance of normal. But our normal is a new normal, and it should be a new normal because there's a lot of things that we need to improve upon the way that we live our lives. So sorry, quite a long-winded answer because I think there's a lot more that we need to do. And I just worry that we'll remain in this pattern of peak and trough and peak and trough, and we can do better.
Thank you very much, Maria. And I think this is the last question I will take from viewers for today. The person watching us from LinkedIn is asking, what is the worst case scenario to solving the global pandemic? Maybe Colleen and Carlos, you would like to start with this one.
So the question being, what's the worst case scenario for solving the pandemic? I guess I would say we're in the worst case scenario, but then that leads me to believe that I think that's also a very daring thing to say. This is not something that I've thought a lot about, but I guess I will just say that if we continue to do nothing, and I think I appreciated Mike's comments about letting coronavirus stop with me. I think we have to focus on solving the problem. I think the worst case scenario probably is much more far-reaching than we're seeing right now. But we also have a lot of growth to do to make it better right now. So there's my off-the-cuff answer.
So I would say, Alex, that the worst case scenario in my mind is that individualism and nationalism triumphs over community and over globalization. I think if people just think about my rights, and my right is that I can do whatever I want and not take care of others, and if countries worry about themselves and not worry about the global situation, we're never going to solve this problem. So I'm hoping that we will end this, and I want to be hopeful and say we have the tools to stop this virus now. We have the ingenuity to stop this virus now. What we need globally from every single individual at the community, at the state, at the local, at the national level is leadership that puts in place the necessary, economic and public health strategies that prevent this virus from continuing to spread. And if we do that, and if we do it collectively as a global community, we will end this virus. But we have to work together. This is not a matter of just worrying about me and my country and my citizens and not worry about everybody else. As Maria said, as long as somebody has this disease, we all have to worry about it.
Thank you so much. Maria, Mike, would you like to add something as well?
I think, Alex, if we started thinking in worst case scenarios, we can go pretty dark because I think all of us can think of scenarios which could be worse. I think we do need to think of the hope. I think we do need to think of the collective action that we need to put in place, which has been said. And I think we need people to come away feeling empowered. There's so much that is wrong in this world, but there is so much that is good. There is so much light and positivity and in many respects, in many parts of the world, in many individuals, some ability to control what we do. And we need people to have the information to know their risk and lower their risk every single day until we get through this. It's going to take some time. I think part of the messaging is, and which I think is very hard, that all of us get questions of is how long, how much longer? How much longer do we have to hold on? And they want a date. They want, when is exactly this going to be over? Because then I can think to that. And I think that's been challenging because people think, well, I can get to that next holiday. I can get to the summer. I can get to the fall. I can get to that vacation that I plan, which I don't know if I can take. And that's a difficult challenge mentally. I think all of us listening right now, all of us are exhausted as well, as I'm sure everybody watching us right now. But we need to start thinking collectively about what we can do, what we should do, and how we're going to do it. So it cannot be done by one country alone. It cannot be done by one community alone. It cannot be done by one region alone. We have to pull together. This is the time where we put on those boots and we really collectively dig in, because vaccines are not going to happen as quickly as we would like, although it's incredibly positive. But until they reach the world's population that need to be reached to have an impact on morbidity and mortality first, and then transmission, every single one of us has to collectively, consciously, knowingly, and willingly act to prevent the virus from infecting ourselves and infecting loved ones. We want to prevent as many infections as we can, but if you are infected, the virus stops with you. So it's a strong message that everyone needs to really hang on to and know that there's something that they can do, and reach out if you need help. That's the last thing. Just reach out if you need help. This is a lot. This is a lot to deal with. It's a long time in the making. We have the youngest children who are dealing with this very differently than adolescents, than young adults to older adults, to people who are isolated in nursing homes. We need to reach out and help each other through this, because collectively we just have to.
Thank you, Maria. And Mike, your words before we close? You're muted, sorry.
Sorry. What she said. No, Maria and Colleen and Carlos have really laid it out there, and I won't go over that again. I would just say that our greatest weakness and our greatest gift right now as a global society is our connectedness. That is the path along which infectious diseases travel. That's the path along which misinformation is traveling. But that connectedness is also our salvation. That ability to come together, to work for each other, to connect our brains, to connect our innovation, to connect our ideas. And in that sense, we're in a battle for the future of this planet, for the future of global civilization. We're faced with this pandemic. We're faced with terrorism and conflict in so many different countries. We're faced with climate change. We're faced with economic, we're only a decade after a major economic collapse globally. And now we have a major pandemic collapse. We're facing climate collapse, all of these things. So we can either look at this challenge as something we are going to win together. And from there, as John F. Kennedy said, he would go to the moon and do all the other things. So people forget that when he announced that the US would go to the moon. He also said we will do the other things. And I think we need to do COVID-19, and then we need to do the other things. We need to fix our planet. We need to fix our societies in terms of their injustice, their inequities. And not because we're good people or because we're goody two-shoes, but because that is the path to security and safety for us all. A colleague of mine who I worked with in Afghanistan, a Danish colleague, and we were talking around the campfire one night. And I remember him saying to me, and it's something that stuck with me for the last 25 years. He said, the most dangerous person in your society is that person that has nothing left to lose. We have too many people on our planet that have lost everything, be it dignity, be it their freedom, be it their rights. We cannot sustain a global society that operates on this basis. And therefore, we are driving risks through our connectedness. But we have the choice to change that. We have the choice to redouble our efforts, deal with COVID, recognize the inequities it's uncovered, deal with those inequities, prepare ourselves better for the next time, fix our planet, fix to the extent we can the injustices that have driven a lot of this pandemic. And I think if we do that, and I'm not saying that can be done today or tomorrow, COVID is our greatest scourge we've faced, but it is also, in one sense, an open door to a new future if we're prepared to walk through that door together. And I think that's the challenge right now. We have a choice as a society, be it as a local community, a national society, or a global society. And we have to make some good choices in the next weeks for ourselves, for our families, and for the world.
Thank you so much, Mike, Maria, Carlos, Colleen, for being with us today. America has been an important player in global health and science, and therefore I would ask Maria to close with explaining once again how WHO has been collaborating with the US scientists during this pandemic.
Oh, thanks, Alex, for the question. I mean, WHO works with American scientists and public health professionals and clinicians and groups. We've been working for decades. This pandemic is no different. The relationships that we have with institutions like the US Centers for Disease Control, the National Institutes for Health, Emory University, universities across the US. We are proud. I'm an American, so I'm totally biased, but we have amazing scientists that we work with that are American. They work with us on our international networks that we have established for COVID-19. So our laboratory network, our clinical network, our risk communication network, our IPC network, our ventilation working groups, different working groups that we have, virus evolution. They work with us to develop guidance and advice and adapt that guidance and advice as we learn the science. They collaborate with us daily in our teleconferences that we have, discussing, debating the science and helping us to interpret what all of this means in terms of practical, manageable, workable advice to all countries and to people all over the world. They work with us in developing trainings, turning that advice into training so that frontline workers can take what is recommended as best practice and apply it in different types of settings all over the world, in different types of clinics, for example, or through tertiary clinics all the way through the most rural clinic that you can think of. To architecture, different architecture working groups that we have, the TechNA network that we have, and making sure that the flow of patients through hospitals, the ventilation through hospitals and in workplaces and in quarantine centers and in homes are good ventilation so that we can improve the amount of fresh air that comes into the spaces that we occupy and we share with others. They work with us on missions to different countries. I was part of the February mission to China, and we had 2 Americans that were with us on that mission. And they participated. We've had hundreds of missions to different countries. And I don't know off the top of my head how many Americans are there. And we have Americans as staff, as part of our teams that are helping collectively to work towards this pandemic. So a lot, I would say, across the gamut of all of the different activities that we have. But it's important, I think the world knows that WHO works very hard to engage all countries and that we try to expand our networks and our reach and our discussion with all countries because all countries have something to contribute. Everyone everywhere has something to contribute to our collective knowledge of this virus, the way it spreads, the diseases it causes, how we treat it and how we care for patients, how we reduce spread, how we roll out vaccines and vaccinations, how we train. And it's important that we continue to do so. America is no different. No matter what, America will be an important partner to WHO, and that will not change. But America is a strong partner, and they will remain so.
Thank you so much, Maria, and a special thanks to Colleen and Carlos for finding the time to be with us today, to share their experience, expertise, and also to answer questions from our viewers who've been watching us from Canada, Germany, Austria, US, Nigeria, Sierra Leone, Chad, Saudi Arabia, Belgium, Argentina, Algeria, Philippines, Afghanistan, Vietnam, Peru, and many, many others. I won't list them all because the list is very long. Huge thank you. And for our viewers, if you want to find out more information and latest updates on COVID-19 and other health issues, visit our website and follow our social media channels. Until next Wednesday, please stay safe. Thank you.